Joenja, also known as leniolisib. Hope Uplifted series. Real patients, real stories.
Hi, my name's Tyler, 25 years old, and I'm a real patient with APDS. I've dealt with the symptoms of APDS as early back as I can remember. So yeah, some of the earliest memories were around coughing fits and things like that, yeah. I had constant golf ball-sized lymph nodes along my jawline. At the worst, there were times where I'd be hospitalized a month at a time because of pneumonia and other issues.
My name is Dr. Eve Wu, and I am a pediatric rheumatologist and allergy immunologist who specializes in children and adults with immune deficiencies. The challenge with APDS is that no two patients look alike. Even those with the exact same genetic variant, every patient's story is unique. These patients usually see a lot of specialists and have a very complicated patient journey, in part because the manifestations can be so varied. Typically, APDS is a progressive disease. It may start in infancy or early in life.
I was roughly 13 when they did the genetic tests to try to identify what was going on. In sequencing my genes, they identified the mutation that causes APDS and identified the disease at that point. I was relieved to have answers, but it was kind of overshadowed by a dread in knowing other people had it.
When I sit down with patients and their caregivers and talk to them about pursuing genetic testing, I usually like to review all of their symptoms they've had and let them know we've come to a point where genetic testing may be helpful in finding a diagnosis. Because APDS was only described in 2013, patients who'd had genetic testing earlier, the APDS gene may not have been included, emphasizing the importance of repeating genetic testing for those who had it done earlier. When I inform families of a genetic confirmation of a diagnosis of APDS, I think families can have a mix of emotions, but I think the predominant emotion is a sense of relief of finally having an answer for all of their symptoms and for their complicated journey.
As far as handling the symptoms of APDS, I had to deal with using a lot of different prescription medications. There were no specific treatments at the time for APDS. Every morning I had to take 9 pills, and every night I had to take 11 at my peak. Even initially having the answer and slowly working on getting better, due to the number of medications I was on, it quite wore on me physically and mentally at that time. There were a lot of issues that were going on constantly, be it organ issues, breathing issues, constant migraines and headache. I'd call any day where I could function a success. I was very scared for the future.
Since no two patients often present similarly, their treatments can also vary, and I try to tailor the treatment to each patient. Treatment for APDS has largely been symptom-based and oftentimes requiring multiple pills and sometimes even infusions. It's not only the symptoms of APDS, but even the treatments that can have a burden on families. These can result in missed days of school, missed days of work, difficulty maintaining relationships. It can really have a large burden on their day-to-day life.
We're offered to participate in the clinical trials as part of our search for answers regarding the disease. I slowly start to see the effects. There was just this relief and blossoming hope. I just watched all these things that I was taking for individual symptoms just go one by one. The lymph nodes that I had dealt with were finally gone, couldn't be felt along the jaw at all, and that was a huge feeling of relief for me. I marked it on my calendar because it was just how much of a milestone that was for me. The relief was palpable. I started noticing that I needed to be hospitalized less and less, and slowly but surely my hospital visits became routine checkups rather than emergencies. I went from a couch potato to walking 5Ks over the course of like 3 months. It was liberating. I definitely realized I had a future to plan for now. where I ignored a lot of that before. Being able to be down to just 2 pills a day to maintain what used to be an entire routine means everything to me.
I was so excited about the approval of Joenja as the first treatment specifically for APDS. Joenja not only works on the symptoms of APDS, but also the underlying cause of the disease. Seeing patients obtain relief from some of their symptoms is the most important thing for me. I have many patients who've had a similar experience to Tyler. Patients who first started out with a low number of naive B cells in particular, we've seen those correct and increase. And for my patients who've had enlargement in their lymph nodes, in their spleen or liver, we've actually seen a reduction in size. The 1 tablet twice a day dosing of Joenja is a big difference from managing various symptoms with a variety of medications. When I speak to my patients about potentially starting Joenja, one of the questions that they have or concerns that they have is around safety. In the clinical trial, was found to be safe and well tolerated.
If I could go back in time and tell myself anything about Joenja, it would be not to worry, because compared to a lot of the other things I've had to deal with, it's nothing. Well, everyone's experience is different. I would just say that Joenja was a big part of giving me a life to live.
For patients with concerns, I encourage them and tell them it's important to discuss questions with your doctor. I trust the data and have seen good results from taking Joenja. APDS is not benign. It can be a progressive disease if untreated. All it takes is one genetic test to find a diagnosis, and then you can help patients manage it. You are not stuck just treating the symptoms. With Joenja, you can actually go to the source of the disease.
Don't be afraid. Joenja made a real difference in my life.
Joenja is a treatment that can help patients with APDS. I am hopeful for the future.
Approved use. Joenja, leniolisib, is a prescription medicine that is used to treat activated phosphoinositide 3-kinase delta, PI3K delta syndrome, APDS, in adults and children 12 years of age and older. Important safety information. Tell your healthcare provider if you are pregnant or plan to become pregnant. Joenja may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start receiving Joenja. Use effective birth control to prevent pregnancy while taking Joenja, and for 1 week after you stop taking Joenja. If you plan to become pregnant, continue taking your birth control for 1 week after stopping Joenja. Talk to your doctor about what type of birth control method is right for you while taking Joenja. It is not known if Joenja passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take Joenja. Tell your healthcare provider and pharmacist about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Joenja and certain other medicines may affect each other. Tell your healthcare provider if you are scheduled to receive an immunization, vaccine. Joenja may affect how well a vaccine works. Discontinue Joenja and seek immediate medical attention if you develop any signs and symptoms of serious allergic reactions, including itching, skin redness, hives, rash, difficulty breathing, or swallowing. The most common side effects of Joenja include headache, inflammation of sinuses, weight gain, and dry, itchy, and inflamed skin, eczema. These are not all the possible side effects of Joenja. Tell your healthcare provider about any side effect that bothers you or does not go away. You can also report negative side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch, or Pharming Medical Affairs at 800-930-5221. For more information, please see the full prescribing information.